May is Mental Health Awareness Month. It's estimated that more than 1 in 5 adults live with a mental illness, but health officials say only about half of them get treatment.
And one of the biggest reasons is because of the stigma attached to mental health. Dr. Frank McGeorge is here with 6 ways to overcome that shame. Doc.
Well, Ty and Kimberly, many people may remember the saying that it's okay to not be okay. That was actually aimed at giving people permission to acknowledge that they were struggling with sadness or whatever emotion they felt. But the fact is, shame and concern about how the world will see us, it holds too many people back from the help they deserve.
It's key to overall well-being, but oftentimes people don't prioritize their mental health like they would physical health.
Still, there's a lot of shame because we somehow think we should be doing it better or we shouldn't experience certain things.
Licensed therapist Jody Baumstein with Children's Healthcare of Atlanta says carrying around that shame can be isolating. She suggests 6 steps to find help through connection and empathy. First, practice self-compassion. Next, challenge unhelpful thoughts. Learn to recognize when they're spiraling and unsupportive and reframe your thinking. Third, seek support. When we talk about mental health openly, we're tackling shame together.
When you connect with other people who have experienced the same thing or are experiencing something similar, your brain says, I'm not alone. There's nothing wrong with me.
Fourth, don't compare your mental health journey to others. Everyone is different. And share your story. When you talk about what you're experiencing, it creates an opportunity for others to feel safe doing the same. And finally, remember, what you're experiencing doesn't define you.
We don't feel like it's who we are and it's taking over our whole life, our whole identity. It's part of us. It's something we experience. It's something we feel.
Now, it's also important to be curious about why you're experiencing mental health shame. If you can get to the root cause of it, that may help to reduce how those shameful thoughts are actually intruding into your life and your mind.
Sure. And I'm sure there are differences between men and women.
Yeah, as you might expect, actually, there definitely are. Men usually feel like they need to hide their emotions, which makes things worse. And that is, frankly, why we see more deaths from suicide among men.
All right.
Thank you, Dr.
Thank you, Doctor.